Hi, I'm Paul Hoffschmidt, the founder and CEO of Alpha Sophia, and today I'm joined by Sanjeev Menon of Ubie. Great to have you on the pod today. So
Nice to see you
tell
again,
us a
Paul.
little bit, yeah, great to reconnect. So tell us a little bit about yourself.
So I'm Sanjeev. I'm the head of partnerships for Ubie in the United States. My background's a little bit non-traditional. I've been a startup growth architect working for Series C startups in the B2B SaaS
Mhm.
and consumer tech space for the last 10 years. So I really come to specialize in scaling new businesses and new products in new
Mhm.
markets. Um, And so what I'm doing with Ubie is helping to launch one of Japan's top digital health startups in Japan into the US market. And we've just set up here as of last year. So first boots on the ground in the US.
Yeah, that's super interesting. And it's actually a story which resonates with many founders in the healthcare and in the medtech space. I regularly talk to who are coming from all of the countries from the world, trying to launch on the US market as the biggest and most valuable healthcare market in the world. And I'm excited to hear a few of your stories, what your experience has been, and what your current strategies are entering that market. But maybe to take one step back to learn a little bit more about Ubie. So you at Ubie, you say that you're on a mission to develop a healthcare guide for everyone. So how would you describe to a layperson what that actually means, what that entails?
When I think of Ubie, I think of my dad. Um, my dad always wanted to be a doctor. He ended up becoming a pilot instead, but he maintained that passion for medicine. So he's read all these clinical
Mm.
textbooks. And so he's become a go-to guy for people when they're feeling sick to check with him and say, hey, I've got this going on. What should I do? And he'll say, he's not giving a diagnosis, but you might have something like this. You should go and see this doctor. And that's really helpful. I call him Dr. Quack, but that's been really helpful for a lot of people who, when something's going on with you, you're anxious, you're lost, you don't know what to do. Um, and helping get people onto care has been something he's
Mm.
been able to do for his friends. So when I look at Ubie, I see Ubie as vet friend who's medically knowledgeable and able to guide you in your at the start of your care journey. Now, 70% of people start their care journey online on Google, looking up health information. And the problem that they have is they don't have the health literacy to decode the information that's in front of them. If you look up persistent headaches, you're going to get anywhere from migraine to meningitis to brain tumor.
Mm.
And it's just going to leave you even more lost than when you started. So,
And you
what
bring
we
some
do,
structure in that search of patients to find potential diseases for the symptoms they have, and then guide them towards the right specialists and so on.
exactly. So, our core technology is disease prediction AI.
Mm.
One of the ways that we've productized that is as a patient-facing symptom checker. So when patients are looking up symptoms online, which is what how they typically start their journey, they land on the Ubie symptom checker. We have a personalized AI questionnaire that takes a snapshot of the patient's current state, asks them uh, a series of 15 to 25 questions to learn more about their condition, and then finally present results on how urgently they need to seek care, why, what type of
Mm.
conditions they should have, what type of doctor they should see, um, and give them that guidance on next steps they should take.
And do you provide this for one certain therapeutic area, or is this across the board?
Right now, we cover over 1,100 diseases in the
Wow.
ICD-11. So it is a general symptom checker that can help guide most people across most conditions that they have.
Okay, really interesting. So this is basically the core of your product, that platform which helps patients to check their symptoms and get guidance towards which kind of disease they might have, who to see, which specialist to see, and so on. And this product is now also the product you're launching on the US market coming from Japan.
That's correct. One of the products.
One of the products. Okay, I'm excited for more. But maybe let's take one step even further back. I mean, that story, your company having emerged in Japan is, I think, pretty interesting. Can you guide us a little bit through the story of how the company was founded in Japan and then has expanded over time and has eventually come to the US market now?
Yeah, of course. So how the company was founded, we have two founders. One is a medical doctor. One is a software engineer who used to work for one of Japan's largest health tech companies. They're best friends from high school, so it's a bit of a romance story. But the engineer, as part of his master's thesis in the University of Tokyo, his name is Kota Kubo, he developed the algorithm to, at the time, he was trying to create an AI doctor. So trying to create a disease prediction flow as part of his thesis. After his postgrad, he continued working on the algorithm, and 4 years later, he managed to convince his doctor, now co-founder, Dr. Abe, to join forces and go to market with a symptom checker. And so, as products, they started off with a patient-facing symptom checker, as well as a provider-facing intake tool and differential diagnosis tool.
Interesting.
So that was the founding 7 years ago, and today they've expanded. They've come a long way. In total, we serve over 10 million patients each month, and
Wow.
over 1,500 provider organizations.
And this is mainly in Japan at the moment, but now also in other countries getting started.
I'd say there's a good portion in Japan. Our US base and global base is increasing rapidly.
Okay.
The provider side of things is mainly in Japan for the moment.
Understood. And then the expansion strategy has in every market been start with the patient facing product and then later on onboard providers as well as the patient numbers are increasing.
We've kind of done both in tandem.
Okay.
And so maybe just to offer some context on our expansion strategy, we initially started with APAC. So our first focus outside Japan was in Singapore and India, and we're pursuing both sides of the business concurrently. Coming into the US, we found that, and you probably know a lot about this, speaking to a lot of GTM teams, it's a much more complex healthcare infrastructure over here. Going to market on the provider side of the business hasn't been as straightforward. So we're dedicating most of our focus to the consumer side of the business for now.
Yeah. And how would you say when you're talking to providers in the US market, how do they look at the evidence you've shown in other markets and see that as a foundation for trust in the US market? Is this something you can build on, or you have to start from scratch here to build that trust?
Yeah, maybe naively, when we first came into this market, we thought that huge base of real world evidence that we had created in Japan would be a very strong foundation in this market. But I think the truth is, what happens in other markets does not count in the US. You start from scratch.
And it's a super interesting take, and which I think is really relevant for any MedTech, health tech, digital healthcare founder coming from a foreign market to the US market to understand the specific market dynamics, how the market works, how trust is built in the market. So excited to learn a bit more from you about that. So maybe you can share a little bit how your role has changed and your perception about growth strategies over the course of the last 1.5 years since you've been starting building the US presence.
Yeah,
Were there any
good
pivotal
question.
moments which shaped the journey?
So I think when we first started off, first step was speaking to customers. So understanding the market from the customer lens, and we must have run over 50 interviews with providers directly to understand their feedback on the products that we were looking to launch. when we ran those interviews, there was the provider feedback was very positive. And so we decided to start going to market and following the traditional sales sort of techniques to get the rubber to hit the road and get adoption. What we found was, I think there was a missing layer, right? People like the products, but they always wanted to see proof. And so creating that foundation of validation and trust was something we thought we had, but realistically, we didn't know that Japanese evidence was not valuable here. So we're kind of going back, going back a little bit, taking a step back to build that layer of trust, build that layer of validation before we move forward again. And I think the key takeaway here is really trust and validation are so important if you're looking to launch a B2B product in the healthcare space in the US.
Yeah, and I think what you're saying is actually true for every medical product being launched on the US market, is that the key for success and then for widespread adoption at some point is to create, as you say, that layer of trust and validation first, to then have a foundation to convince early adopters start using it, then having word of mouth spreading and getting deeper and deeper into the system. It's a little bit like a chicken egg problem, yeah, where you first have to have that layer of trust and validation to get the first people to join, and then to have them join, you need that as well. So getting that off the ground is really the secret magic trick you have to pull off in the beginning when launching a new product, right?
Very, very much so. I think there's a very clear playbook. I think if someone were to distill that playbook into an actual book, they'd make a lot of money. But yeah, there is a playbook. There's a way to do it. I think it's just being aware of it and being
Yeah.
aware of that market nuance, especially for people coming from overseas, that the US healthcare ecosystem is unlike anywhere else that you've played before.
Simple question. Can you afford to have a rep in every county, or do you need to be hyper-targeted in your outreach? Do you need to know information about your targets going in to be successful, or do you have years and years before you want to close that deal? If you want to be focused, if you want to deliver fast, you should visit alphasophia.com and help your sales team out.
Is there any kind of partnership strategies you've gone after to get faster into the market? When I talk to medical device founders, for example, many partner with distributors and the likes to basically leap jump into the market and get closer to potential customers at a faster rate. Have you tried any of those partnership strategies?
Yeah, I think where we're looking, and we're probably one step behind that at the moment. We're still building that trust and validation foundation. But once we do that, we'll definitely be looking at channel partnerships that accelerate our go-to-market.
Okay, yeah, that's interesting. And especially, I mean, your product, from what I understand, is a little bit like a marketplace. Is it in the ultimate evolution stage, where you have both patients on the one hand side and then providers on the other hand side using the product, right? So it's like a two-sided product eventually.
Well, where we see ourselves ideally is at the center of the healthcare ecosystem, playing across the continuum of the patient journey, right? So what happens at symptom onset? There's a Ubie solution for you. When you want to go see a doctor, there's a Ubie solution to help you intake more easily. What happens in the office? There's a Ubie solution that's helping your provider save administration time and spend more time with you. After the visit, there's a Ubie solution that helps you track your condition in between. You know, it's usually 6 months between specialist visits. What's happening in between? We want to help you track and ensure your adherence and help you flag any outliers in that journey. So across the patient continuum, as well as at the center of the ecosystem, so between providers, patients, and life science companies, and helping everyone speak to each other more easily.
Yeah, interesting. Maybe one other question to that panel of providers you did those 50 interviews with in the beginning to validate whether to launch certain products in the market. How did you actually find those initial interview partners in the provider market? What were strategies you employed to start talking to them? Was it just from network, or were there any other sources you used to get in touch with them?
Yeah, there are a couple of amazing platforms out there that connect providers to technology companies. Enlightened was, I don't know if I should be plugging other companies here, but Enlightened was great. There was another platform that merged with Enlightened, and it's escaping me at the moment, but we were using these platforms where there was ready access to providers looking to consult digital health companies.
Okay, then you had expert interviews with those providers through those platforms. And I imagine those companies you mentioned, those are like expert interview platforms where you can get access to certain panel groups to conduct those interviews with, right?
Exactly.
Yeah, that can be a good strategy, and actually time-efficient strategy to get first feedback from a market. It doesn't probably really work when you actually then do actual sales, because those platforms are more geared towards advice and interviews and consultancy. But it's definitely a really good source to get quick market validation and feedback about certain solutions.
Very much so.
And that's really interesting. And that's also maybe a strategy some of the listeners can employ when they plan their launch with a new product on the US market. Maybe one step further, along the path, you already shared about how you looked at the different types of stakeholders, from patients to providers to life science companies. But have there been pivotal moments of the course of your upstart in the US which have shaped the path so far?
Pivotal moments in the US itself?
Yeah, I would say, yeah.
Okay. In the US itself, I guess one of the pivotal moments was, of course, that realization that basically the playbook from Japan didn't work in the US. So that in itself caused us to pivot or rethink our direction. I would say another pivotal moment has been just we have a consumer-facing platform, and seeing the incredible growth and engagement that's afforded us. In business development, I'm a big fan of following market feedback. And if the market is telling you that this is a direction, you got to follow it, right?
Yeah.
It's leaving breadcrumbs. You don't want to ignore them.
Yeah, and I think there are like two key learnings in that message. Yeah, first of all, playbooks that work in one country don't necessarily work in another country when it comes to go to market, because structures are so different. And then secondly, when you figure out the playbook from one country isn't working, don't hold on to it for too long. So do your A/B testing, try it out. If it doesn't work, switch strategies, and don't waste further resources on a playbook that doesn't work out and scale. I think that's a key learning to have in mind.
I would add one more thing, and I'd say that in this market, I don't know, I'm happy to be proven wrong, but I don't think there are quick fixes. The success in US healthcare, I was at a Google checkup last month, and there was a fantastic quote from their CMO. Healthcare moves at the speed of trust. And if you're looking for success in a 6-month time frame or a 1-year time frame, like you could do with, I guess, more traditional B2B SaaS GTMs, I don't think that's going to happen. You got to look at things from a longer term horizon, and especially if you're a startup, you need to make sure you have enough runway to weather the storm, because I think some success in here is attributed to just time in market. Not all, but some.
True. And especially when it comes to, I mean, things like building up brand over time, and then also more traditional growth channels like building a reputation on for search engine optimization, just be higher ranked and so on. That just takes time. Of course, hard work as well, but it takes time for actually to materialize. Um, on the latter, maybe how are you actually approaching growth in the patient market? So how are you getting patients on your platform?
Yeah, I guess we don't pursue direct acquisition strategies. So we're not doing like consumer focused ads. And a large portion of our success is attributed to search engine optimization. So
Okay.
being there when people are looking for symptoms. Um, and so part of that is increasing just organic brand awareness. So we
Yeah.
get direct traffic and that's increasing, but we've been working with other partners um, that I mean, we've been doing some interesting stuff in the press as well that's increasing who's talking about us, which increases our search engine presence, which ultimately
Understand.
gives us better positions when people are looking up their symptoms.
Yeah, that's really interesting. Yeah, and then excited to hear when there's news coming out from that direction.
Yeah,
So
I mean,
yeah, sorry.
go on, sorry.
No, no, I take it.
Yeah, I'd say one of the other interesting avenues we've been going down has been working with patient groups. So, I mean, this is very specific to disease
Certain disease
prediction.
fields.
Yes, exactly. So going down individual disease fields and working with patient groups. Um, these are there's very strong mission alignment there, right? For a lot of rare diseases specifically, you have very long patient journeys. Time to diagnosis is 5 to 10 years. So we have mission alignment in reducing those diagnosis times, reducing time to treatment. So finding the right partner that is aligned in mission that can help accelerate your growth is also something I'd say is incredibly valuable.
So by doing that, by tackling patient group by patient group, you basically break up the market into many smaller markets where you can tackle one by another and then be really present in one smaller nucleus and be out there, be known by those patients in that nucleus, get a critical mass, and then get on to the next one. I mean, that's a growth strategy that has a little bit actually like how Facebook started, going from college to college, having really small markets and then winning them over. So I think that's a really smart way of tackling that problem of acquiring a critical mass in patients in total on your platform.
I think there's this old marketing saying, right? If you're speaking to everyone, you're speaking to no one.
Yeah.
So there's something to be said about going really niche and being just a really strong value provider within that niche, right? And then if you're providing enough value to people, that's where word of mouth spreads and that's where you grow as well.
Yeah, that's something to write down for everyone. I mean, that's really insightful. Maybe as a closing question, what's up next for Ubie in the
What's
next
up
weeks,
next?
months, and years?
Grow, right? We're a startup. So I mean, we're continuing and focusing on growth.
Yeah.
But I think one of the most exciting things for us is expanding our solutions across the patient journey. So right now we have our patient-facing symptom checker that's helping people navigate care at symptom onset. We've just launched our new product checkup, which is in pilot now for patients with asthma. And excuse me, this is the product that's helping people navigate their conditions in between visits. So medication reminders, appointment reminders, but also giving them a check so that, or flags, so that if anything pops up between visits, it encourages them to go seek care uh, immediately or urgently if they do. So just managing conditions in between visits. I think that's something we're very excited about and looking to expand the value we are providing patients.
really exciting, and I'm really looking forward to hearing more from you, and how you grow that company in the US market and providing value to patients. I think it's a great mission you are after. Thanks for joining us today. It was a really nice conversation, and looking forward to have you back on the pod at some point when you hit the next milestones with Ubie.
I would love that. Thanks so much, Paul. So nice to see you again.
Thank you.
All right, take care.
Okay, med device folks, picture this. What if you could open up a CRM today and it already contained information for every potential lead for you in the country? And you could narrow down those leads further by looking at billing, location, seniority, so much more. Alpha Sophia is the strategy tool that we wish we had had when we were commercializing a medical device in the US market. But there's nothing stopping you. So visit alphasophia.com and learn more.